Good evening, everyone. A warm welcome to this free session of neurotherapy. And this has been always a Friday session. So we term it as Friday series. But this particular session is always, all old students know the value of this neurotherapy. But I guess the new students would be wondering what is neurotherapy. So just for the sake of finding out what is neurotherapy, we would like to let you know that we have our Acharyaji Ramachandran sir, who was trained by Dr. Lajpat Rai Mehra. He was the pioneer of neurotherapy and a non-medical healing technique that focuses on treating ailments by stimulating specific points in the body. This method is rooted in the belief that the navel is the epicenter of the body and disturbances in its position can lead to various health issues. So our Dr. Mehra ji developed this innovative approach to help people without relying on medicines, because medicines have been taking lots of our spaces, money, and many things. So Dr. Mehra ji has developed this innovative approach, blending ancient Indian philosophy with anatomy and physiology also. And our Ramachandran sir is very much an international trainer in this particular series of neurotherapy, and he had trained internationally almost around maybe 10,000 plus trainers so far in so many years. So this particular neurotherapy, we have many centers also which offer treatments for conditions like paralysis, piles, digestive disorders, among others. So, and how does neurotherapy work? Actually, there's a technique in neurotherapy which employs various techniques to stimulate and balance the body systems. Some of the key methods include pressure application, manipulation of the navel, stretching and movement, and dietary recommendations. So all this will be explained in the major sessions of neurotherapy. But to give you a brief of them, with pressure application, applying pressure to specific points on the body in specific sequences and for specific periods of time to stimulate the flow of blood, lymph, and nerves and improve blood flow. Effectively, we are diverting the flow of blood from areas of excess supply to areas of deficit supply. Not only that, but whatever the blockages are there, with this particular pressure, those blockages are also relieved from that particular place, making the blood flow smooth or the circulation smooth. Okay. So this physical application is very much used in neurotherapy as part of a treatment. And next, coming to the manipulation of the navel, adjusting the navel's position to restore balance in the body as it is considered the center of energy. See, our navel is considered as the central part of the body. And when it is aligned, our full body would be aligned. But when it is not aligned, we find many difficulties because navel, what happens when it is not aligned, it moves away all the other body parts like organs or spleen, liver, or whatever surrounding them. The movement creates lots of imbalances in the body, creating many root cause troubles which can't be healed just like that. So this navel manipulation is also used in neurotherapy. And other things are stretching and movement. Encouraging proper alignment and flexibility to enhance the body's natural healing processes are very important to make the alignment easy and to make the circulation very clear for the body, because circulation is very important in the whole body. We have many types of circulation systems in the body, like lymphatic systems, which has to be cleared from the body, and blood circulation, which has to be improved to make everything easy for the body to, circulate and make us healthy. So, and dietary recommendations also done through neurotherapy. Wherever it is suggested, on specific foods to support the body's recovery and maintain balance. So this is very, very important because unless our food is proper, unless we are eating properly, following good lifestyle, because bad lifestyle also creates alignment issues and circulation issues. And when you're not sleeping on time and not eating on time, that also creates body can't you are directly harming the body when you're not sleeping and eating on time. So that is very important for everyone to firstly maintain our food balances. And with neurotherapy, all these are instructed during the therapy, during the classes, during personal consultations. Okay, so these techniques aim to address the root cause of ailments without relying on medication. So now to learn this, fabulous therapy of neurotherapy, which clears all the root causes and gives us a good health. Let us learn it from our Acharyaji Ramachandran sir today. A warm welcome to you, sir, from all of us. And good evening to you. Please take over the session, sir. Thank you so much.
Good evening. Okay. So here we see the founder pioneer of neurotherapy, Dr. Lajpat Rai Mehra, and though he is not a medical doctor, of course he got the doctorate degree through Zoroastrian College for his other efforts, scientific efforts. Okay, so here we see, as Madam has so beautifully explained, some of the sums I will be repeating because some people have joined new, so I'm repeating. And once again, I repeat Anusha Madam's one request is that, being a very nice class, it's a new class, it's a new subject. I request all of you who have your friends and relatives, whatever be their ailments, let them join this course, because let them join today's class. Because unless they know what this therapy is all about, all of you know about TCM, all of you know about acupressure, acupuncture, all these are having each and every system has its own very great plus points, no doubt. But still, a new system may be able to help where certain old systems are unable to help, because every system has its own limitations, and it works for some people, may not work for some other people. So those people who are not able to completely get satisfactory results from one therapy can come to neurotherapy. And as Madam says, because we are going to the root cause, that is why the therapy treatment is effective, because of that particular point, going to the root cause, which of course many holistic systems are following. Going to the root cause is something which everybody does. But still, I request that if any of you have any friends, please ring them up, please, because whatever Madam has said, I am going to repeat that. So right now you can all go to your phones and request other people whom you know. See, Vasudhaiva Kutumbakam is a very famous slogan in our country. That means the whole world is our family. I should not think, once I have got benefited by something, then I should spread the word of goodness around. That's how it should be. So with this request, let us start this session. Now I'll be touching certain things, repetitions. And now here I am already putting on the screen whatever I have prepared notes, so that any of you at any time you can take. These are not needed, but later on, as I am coming to certain formulas, you can take your screenshots, absolutely no problem. You can take your screenshots, and then you can later on, if necessary, you can discuss with me. Maybe today we may not have too much time for question answer session, because I want to cover a lot more things, but still we may have a few questions. Okay, so with this preamble, I thank Anusha Madam, I thank Joshys sir and Joshys Kerala group and all the people working behind the scenes to make this a very successful program. And I personally, individually thank each and every one of you There are right now 90 people over here, 89 people over here who have joined. I thank each and every one of you for sparing your time, sparing your efforts to come and attend this session. Thank you. So now Dr. Lajpat Rai Mehra, he was a pioneer of neurotherapy. It's called Lajpat Rai Mehra's neurotherapy. The word neurotherapy, though a diminutive, nowadays we see there are almost 31 to 32 people. I mean, 31 to 32 branches of science, which are all called neurotherapy. There is a very famous neurotherapy in from Australia. It is called biofeedback neurotherapy. So it has got its own. It uses computers for certain things. But the type of treatment which Dr. Lajpat Rai Mehra has evolved, that is called Lajpat Rai Mehra's neurotherapy. And what does it do? It focuses on treating the ailments by stimulating specific points in the body. See, our workshop is only the body. Almost all holistic systems are working only with that premise. So it works on this. And as Madam said, it is rooted in the fact that the navel is the epicenter of the body. So what does it mean? Epicenter means what? That means almost all the parts of the body have developed only from the navel. When the child was in the mother's womb, that from that time, conception has started. Within 14 days, the child has started getting some shape. But how does it start? It starts right from the umbilical cord, the navel. From there, one cell becomes two cells, 1 to 2, 2 to 4, 4 to 8, 8 to 16. Like that, it goes on multiplication, cell multiplication. And that's how it goes on. The whole body is developed in that fashion. So because of that fact, we are paying a lot of attention to setting right the navel. For those who understand Hindi, it is called dharan or pichoti, baigola, dudi. There are so many local names for this, setting right the navel. And in fact, Dr. Mehra, when he got this knowledge at the age of 10, not 25, 30, 40. He got it at the age of 10. And he used this knowledge from that age to treat people, to help people to get out of their ailments. That is why it is we, and I personally and all our therapists, we consider it as a divine gift. Because everybody, every holistic therapy works on the body. But this is something very unique. So certain things which you cannot even fathom. As we come to it, I will let you know what are these uniqueness. So now he developed this innovative approach to help people without relying on medicines. Basically, that was what it was. He said, I want people to be free from medicines and be healthy. And right now, for the past, say, 20, 30 years or 40 years, we are all trained to think and believe that our solution for all the problems in the body lies only in medicines. But that's not really true. As acupressure, acupuncture, TCM, all these are proving it does not rely on medicines. So similarly, we also, without relying on medicines, this therapy blends ancient Indian philosophy with modern anatomy and physiology. And then, of course, so many types of these things, diseases are covered. Here we are given only a few names, paralysis, piles, etc. Many more, we'll see that later. So this is how it is. Then the question arises, what are the techniques used in neurotherapy? So in neurotherapies, we are using many various techniques. Okay, we are using various techniques. But some of the main thing is, one of them is pressure application. This pressure cannot be applied at random. It cannot be applied in any sequence. Different sequences have different effects on the body. That is another beauty. It is not that you can say you can treat one point first and then any other point later and then again come back to some other point. No, it has to be in a particular sequence, and these sequences are all laid out by Dr. Mehra. And later on, of course, we have got, as Madam said, almost 10,000 people working all over India and in a few centers abroad also. So we have got a lot of innovations are also going on. Okay, so this is one. And manipulation of the navel, I told you, is adjusting. What happens? See, the navel, it cannot move anywhere. But When with respect to the navel, all the organs, that it be the liver or the pancreas or the intestines or the stomach, all these organs have a certain finite distance. Now, because of our wrong postures, because we suppose I'm sitting like this, or I'm sitting like this, or I'm sitting like this, very in a slouching posture, because of all these things, what happens? The body alignment gets out of order. And when that happens, the navel, the relative distance between the navel and some of the organs, it gets disturbed. Some goes away, and this many of you might be knowing. When you touch the navel, when we touch the navel, this thing should be right in the center. Okay, I'll just, for some time I will stop the share, and again I will come back to the share. Okay, so when we touch the navel, the throbbing should be right in the center when we press our hand into the navel. But quite often we will see that the throbbing is here or here or here. It is at a different place. That is what we mean by the navel is displaced. It is not in its proper location. That's what we mean. Okay. So now we continue this. And so this adjusting the navel is one of our most important techniques, let us say. Then, of course, encouraging proper alignment and flexibility and dietary recommendations. We always say that DET, any disease, diet is the first. Diet, exercise, finally comes treatment. Even with the diabetes, that is what we recommend. We recommend everybody first follow your diet, then do the exercises as we are suggesting, and then finally go to treatment. Whether it is treatment by medicines or whether it is treatment by neurotherapy or other holistic methods. Okay, so we suggest specific foods in our advanced classes. We even suggest certain things. Otherwise, there are now about diet, there is so much information available in the net that we don't have to bother much. You have got enough support there. So now the pressure application, how does it happen? So here we are balancing, promote healing by balancing the flow of blood, lymph, and nerve currents. Blood, lymph, and nerve currents. These three are balanced by our techniques. And so for that, first what we do, we identify what is called as pain points. And these pain points are not the type of pain points which you and I know as leg ache or neck ache or headache or body ache, etc. Right side shoulder is paining, left side arm is paining. No, these are not that. Dr. Behra has found out that there are about 18 or to 20 points in and around the navel, both from the front side and on the back side. Mainly they are on the front side, some are on the back side. So these points, whatever be the name of the disease, these points, the certain sequence of points will have certain problems. It can exhibit as the pain either on touching or pain without touching, or it can exhibit as tightness of the muscles, etc. And so we set that right. And that is what, first we identify the pain points. And then these pain points are correspond to imbalances in blood flow. Wait 1 second. So they imbalances in blood or lymph flow. Then we apply pressure. The pressure has to be given, as I said, in a particular sequence, and it has to be given for a particular period of time. Normally, it is 6 seconds. In 6 seconds, that is why you will see in my earlier classes, those who have attended, they know that when I say 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, that is 6 seconds pressure. So like that, 6 seconds pressure has to be applied. You cannot apply pressure for a long time without this thing, because overstimulation also produces, it is like overdosage. So we have to apply pressure for 6 seconds. Later on in our, when those who join our regular classes for neurotherapy, as and when I announce it, then they will come to know how the 6 seconds pressure is calculated, why it was 6 seconds pressure, etc. All those things they will come to. We'll be telling. Right now, it is not needed for an average knowledge. You should know that we apply 6 seconds pressure. And some cases there may be a different type of pressure. Okay, but in general, it's 6 seconds pressure. Then by doing this, what we are doing, we are directing the blood and flow from areas of excess supply to areas of deficit supply. This is how it alleviates the pain and improves the function of the organ. Then it is not that the same treatment will be given for every day for everybody. For different people, say for example, headache, let us say. Headache, we can have 3 or 4 or 5 different types of treatments, because the headache is only a symptom. The constitution of the person is maybe different for different people. Maybe for the same person, his constitution may be different on different days also. So with that, we have to change the treatment. So we are tailoring the treatment to the person's constitution. So that is the beauty of this therapy, is that though we have got certain guidelines, the guidelines always are there, always with the background that it will be tailor-made to that person's constitution of that day. I repeat, the treatments are custom devised to suit the requirements of the person's constitution on that day. So this is what we have to understand. So why it takes about almost a year and a half to properly understand and formulate your own formulas. Till the time we do hand holding for those who are with us. We do hand holding. So we help in every way. But the thing is that why it takes such a long time? Because you have to understand the constitution, how it keeps on changing. You have to understand the physiology of it, and then you can apply the treatments. Okay, so that is what this personalized approach makes neurotherapy unique. So this is what we have to understand. Then it is this thing. It is a very holistic treatment. So because we are going to the root causes of imbalances, this technique aims to enhance overall well-being and without the use of medication. Again, we always emphasize, we don't give any medicines. It is not that we tell you to stop medicines also. It is not so. It is a complementary therapy in the sense that if you are having medicines, you can continue it till your doctor sees your improvement, and then he will say, okay, now you can reduce this. For example, many diabetics, they are on metformin and other other tablets, or even on insulin. The juvenile diabetics are on insulin. They have seen, when they see the results with us, then they go to the doctor and say, see doctor, my blood sugar has come down somewhat, and it is continuously staying at a lower level. Please help me to reduce the dosage. So normally the doctors also know that they don't have to drug the patient, so they reduce the dosage. So in this way, this is how they are doing. This is how we are doing. So what conditions can this technique help to treat? So because we are addressing the flow of blood and lymph, so digestive disorders is the primary area, because our entire thing, all the chemicals of the body are dependent upon the digestion. So digestive disorders is the primary area, and out of that, constipation, indigestion, these are just a name. There are so many: acidity, belching, all these things. We have got simple treatments to help. Okay, then joint and muscle pain. So that is where your shoulder pain, back pain, leg pain, neck pain, ankle pain, etc. Spur, pain due to spur, all these things we can help. Okay, then we have got relief from arthritis and other musculoskeletal problems. Then neurological conditions. This is another place. Neurological conditions like paralysis. We have seen that even if a person takes a treatment from a therapist, even on the first day, from a trained therapist, if he takes, on the first day itself, we have seen 30 to 35% improvement in the symptoms of paralysis. It's not that he will overnight become all right. No, certainly not. It takes about 3 to 4 months. In some cases, it may take longer time also, depending on the chronic nature of the patient's constitution. But in general, we have seen that a person who is paralyzed says, after receiving our complete treatment for even 1 day or 2 days, he says, yes, I am feeling better. And how do we know that? That suppose there is a gap in 1 day, he does not come for the treatment, then next day he will come and say, see, yesterday I did not come for treatment, I was not feeling so comfortable. He himself says that, he or she. Okay. So neurological conditions. Then respiratory disorders, for example, asthma, bronchitis. Then we have another type of asthma, which is called as cardiac asthma. Asthma, bronchitis are known to you. Cardiac asthma means it is asthma related to the heart. Means how do we define it? It is a type of breathlessness. Asthma means basically breathlessness. Now, as we understand, we all know asthmatic people have breathlessness, problem of breathlessness. So when you are walking or when you are moving about, when you are suppose you are climbing stairs or you are lifting a small weight, at that time you feel breathless, that we call as cardiac asthma. And for cardiac asthma, we have got wonderful treatments, I tell you. Wonderful treatment. Within 2-3 days, the patient starts feeling greatly relieved. And all these things we will be teaching in some of our advanced classes. Okay, but I am only giving you the gamut, the wide gamut of the therapy, because I see many of you are only newcomers. So I'm really very happy that all newcomers, please understand, if you attend these classes regularly and you join my courses, you will definitely find relief from so many common ailments. Okay. And right now we are giving in today's lecture, we are teaching do it yourself treatments. Okay, we'll be teaching you some treatments, of course, but to do it yourself. And for those who are old comers, those treatments may be already repetitions. But newcomers who are not exposed to neurotherapy, for them, they should get complete benefit. So I will be repeating certain things, but you will be getting a lot of practical knowledge. So you will understand if you follow properly, and I take a lot of pains in patiently explaining. And if you do not understand, you can raise your digital hand and I will repeat whatever is to be repeated. So I am there with you. Please make proper use of my expertise. Okay. Then circulatory issues. This is another place. Then how neurotherapy is helping paralysis? Because in paralysis, the circulation to the brain is hampered, is not proper. So when we are helping circulation, when we are helping paralytics, so that means the body does not say that a particular treatment for circulation will only work to the brain. It will work in every part of the body. So the overall circulation starts getting benefited. So, and because it is tailored to the individual's needs, it is making it a versatile approach to healing. Okay, what are the special benefits? Now, special benefits is, number one, it is non-invasive. It is non-invasive and holistic. Number two, because it does not require any medication. Sorry. So it does not require any medication or surgery. So it is safe and natural way to support the body's natural healing mechanism. That is what I keep on saying. The body, all of you know, the body has its own natural way of healing. And all that we are doing in neurotherapy is just stimulate that process to its proper direction. Okay. Then pain relief. By improving blood flow and stimulating the nerves, it is helping to reduce pain and discomfort. And as I said, arthritis, back pain, etc., all sorts of pains. Even to the extent in neuromuscular disorders, there is a very unwanted disorder called cerebral palsy and spasticity. By our treatments, we are able to reduce the spasticity of children afflicted with cerebral palsy. Understand? So we are able to do all those things, and all those things will be taught, of course, in serious, in advanced cases. And right now, those who are having children with special needs, those who are having children with special needs, be it autism, be it mental retardation, be it Mongolism, be it cerebral palsy, you can please contact me. I will try to help you to the best of your ability. But for all that, that has to be a one-to-one session. And it can be done. Okay, I can help. People who want to get help, I am ready to help. And okay, so then by enhanced circulation, as I said, we are restoring proper blood flow and lymphatic flow. And by doing that, what happens when the blood and lymph flows properly, there is better oxygenation. When there is better oxygenation, the kidneys work better, the lungs work better, the whole system works better. And so there is natural detoxification. Understand? Of course, we have got specific treatments for detoxification also, but in general, when we are having a treatment called oxygen treatment. It's a pretty long treatment. Okay, it's called oxygen treatment. We have seen that it actually increases the utility of oxygen in the tissues. You know, all of you know that for oxygen treatment, for oxygen consumption utilization, we have this thing, this pulse oximeter. That pulse oximeter reading gives you that suppose a person's oximeter reading is 90, which is very low. You should have 97, 98, but 90 is very low. Even less than that, 85 also is very low. So when we give this treatment, oxygen treatment, once or twice, we have seen from 90, it goes to 94, 93, 95, etc. in 2 or 3 treatments. And later on, of course, this effect will not last for a long time. But the beauty is, suppose the earlier it was 85. Even when you give oxygen, you know, people are giving oxygen through ventilators, etc. So, or through oxygen mask. Through that, when you give, the oxygen will temporarily shoot up, and later on it will go down to wherever it was earlier. But here, suppose we started at 85. We give this treatment, it goes to 87. Then we repeat the treatment again, it goes to 90 or 92. But later on, after 2 hours or 3 hours, it doesn't fall back to 85. It may be at 87 or 88 or 89. So that is the beauty. That means what? We have increased the utilization of oxygen by the body cells. And how is it happening? Because we are giving a very specific treatment where the circulation to each and every organ is improved by special treatment. Very simple treatment. It can be learned. We teach it to children, to parents of children with special needs, because they require oxygen too much. So we teach all those things. Okay. And neurological support. By all this, we are giving neurological support to help the body regain some degree of function. And finally, of course, we are having holistic balance. By aligning the body systems, it contributes to a sense of overall well-being, making it effective for physical, mental, and emotional health. This technique lies in its simplicity and focuses on harnessing the body's natural ability to heal. I always keep on repeating, the body has a natural ability to heal, and we are focusing on that. And I'm now very happy 95 people have joined. Very good. Okay, very nice. Thank you very much. Okay, now I am going to now start with some simple, let us say, techniques to help our body. Okay, for this I require you to see me properly. So I will show you. You can all see. Now please, all of you can, once again I repeat, all of you can tell some more people that now we are starting the practical class. Up till now it was blah 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 I was doing. Of course it was also useful, but it is not. Those who are not interested in lecture baji, they may say that this is I want practicals. Now start the practical class from 8:40 to 9:40. we are going to cover a number of points. And at 9:40 or so, we will, for about 5-7 minutes, we may have a small question answer session. 9:50, we are going to stop. And I will be blessing all of you. So I request everybody to stay till the end. Okay. And you will definitely enjoy it, actually. Okay. Now, we have got hormones for metabolism that is called thyroid hormones, T3, T4. Okay. Now, T3, T4 we are giving by L-troxin, thyroxine, etc. We are giving from outside for people who are having hypothyroidism. Yeah, that's true. Okay, it works also. Definitely it will be working. But many of these things, they become addictive, and then you have to go on slowly increasing the dosage, and which later on finally becomes toxic to the tissues. Okay. So what is the work of T3, T4? Same work we can do by simple stimulation. And where is the stimulation? First of all, we should know where is the thyroid gland. The thyroid gland is here behind this Adam's apple. This is the Adam's apple. And I just have to keep my finger like this, and then just gently I give a jab like that. That's all. This stimulates the thyroid gland. Right now, those of you who are seeing me, I have only one small word of caution. This activating the thyroid gland at night is not always very necessary. I am showing you because our class is at night. And it does not really matter. I will tell you what happens. The thyroid gland is the gland for metabolism. And whenever the body metabolism is there, you start becoming more active. In fact, we suggest to people who say, my son is going to appear for examination, but he falls asleep by 8 p.m. What do I do? Then I say, okay, you can, as an emergency measure, you can activate the thyroid gland by this technique. But I will not recommend it every day, because then it prevents you from going to sleep for quite some time. But we have got also a treatment called serotonin treatment, which benefits sleep. And all of you know, I have seen in Joshys Kerala group, a lot of message about serotonin has been given there by a few well-wishers. So the serotonin treatment also is there for us, which will prevent us from going asleep. Which will help us to get better sleep, calm the nerves, and help us to get better sleep. And we also have this thyroid treatment, which prevents us from sleeping, but for a small time. It was not that it will, once you give it, it will last till 6 a.m. in the morning. No, it may last for 2-3 hours, 4 hours. So you can, any of you want to know how it is to be done, you have to just keep your hand like this, and then just this the muscle inside of the Adam's apple. This is the cartilage over here. It's quite a hard piece of bone type. Okay, just behind that, you just have to give two simple jabs. The jab like this, 1, 2. That's all. Okay, that's all you have to do. But this is another. Without doing all this, without directly involving the thyroid gland and overstimulating or what, there is one very simple thing. Now this thyroid gland, it is here. So on the left and right side of this muscle over here, there are muscle on this side, and muscle on this side. One works as a heater and one works as a cooler. Can you believe it? No, difficult to believe. How can that be, sir? Heater and cooler. I'll tell you, yes. Just to give you an example, there is one pranayama called Shitali pranayama. Through this, you just do another pranayama is called Sadant. So you make a U of this. This is Shitali pranayama, Shitali or Shitkari. Okay. Your body becomes cool. The whole body becomes cool. So that is possible to cool the body. But here we can cool the body and we can also heat the body. Which side is heater? Which side is cooler? The left side. The left side is the heater. The left side of the body, when suppose it is paining, Suppose it is paining too much, then I will feel very cold. And naturally, the right side is the cooler. Suppose it is paining, you have to remove it. The heat is coming because it is paining. Cooler is not able to work. I repeat again, the left side of this muscle is over here. You know, if you touch it and you find it is hot, then you can see maybe your fingers are getting very, very cold. Maybe your body is cooler than others. Maybe you are not liking the fan. AC, of course, you will not like at all. So these are all the symptoms of knowing that the heater cooler mechanism is imbalance. The heater is not working properly, then your body becomes cold. And what you have to do, just keep your hand, you just shake it, just a little bit, just shake a little bit. Okay, like that. And if you find a pain, then you know that is why you are feeling cold. Okay, of course, the pain maybe you may argue that the pain is after all, sir, it is muscular pain, it is cervical pain, I have got cervical spondylosis. All are right. That the arguments are right, but I am giving you a solution. If you are having cold body, then use this solution. Just press here, just shake the area. If you shake the area, that is enough. Okay, and then you will see very good results. Similarly, suppose your body, you are feeling very hot. You are sitting under the fan and still you are not getting much benefit. Why? Because this muscle is not relaxed. When I am doing this, what I am doing is I am relaxing the tightness in the muscle. Similarly, this muscle is not relaxed. So just shake it lightly. If you shake it, then you will start feeling cooler. So left side is heater, right side is cooler. And where is this location? Just on both sides of this hyoid cartilage. That is where the thyroid gland resides, behind this. Okay. So very simple. Fine. Then body temperature. So I told you one treatment for heating and for cooling the body. Left side heater, right side cooler. And you can do this at any time. For example, you have to get up early in the morning, and you have to catch a flight, let us say. And then at that time, early in the morning, it's very temperature is always very cool. So you shiver, and then you put on this thing, warm clothes and all that. I don't mind if you put on the warm clothes, it's all right. But before that, just see which side is paining, and what do you want to do? You want to heat up the body. So heat up the body means this side, left side is heater. So just you shake it for about 1 minute. You shake, finished. Then your body, you won't require any warm clothes for the time being. Of course, still you can take it as a standby measure. So left side heater, right side cooler. Then body temperature. The body temperature is also controlled to a certain extent by the thyroid gland, but the most important organ which controls body temperature is the liver. And in neurotherapy, we have a lovely treatment for the liver. Very simple treatment. I have put it so many times in the group, Joshys Kerala group. Still, I will show, because many of you might have joined later. You may not have seen those videos. So I will show you. Very simple treatment. All of you can do it. It can be done even now, because you are not going to lose anything. It is not going to make you sleepy or lose your sleep or anything. You will feel much better. You will feel very, very energetic. Why? Because the liver is the mother of the body. It is the mother. All of you know it. The liver is very, very important. So let us go and let us help the mother to have her normal circulation. You know, some children, they come, their tongue is white. Then you can understand, if their tongue is white, after 3 to 4 days, they are going to fall sick. They are going to have fever. 100%. We have seen it. Thousands and lakhs of cases. All that you have to, then you will say, so what should we do? You should should immediately go to a doctor. You can go to a doctor later, but first give them the liver treatment. And how the liver treatment is to be given, then I am now going to show on oneself. And then by knowing the treatment, you can understand how you can do it for another person, for your child or grandchild, etc. So how do you do? Where is the liver? The major portion of the liver is on the right side. In neurotherapy, I have told you that neurotherapy is working on the principle to send blood supply from areas of excess supply to areas of the deficit supply. Now, when the liver is not functioning properly, what does it mean? It means the liver is not getting proper blood supply. Isn't it so simple? Fundamental, in fact. So all that I have to do is what? I have to stimulate the blood circulation to the liver. Then you will say, how to know how to stimulate the blood circulation to the liver? I will give you a very simple fundamental technique of neurotherapy. When you press any organ on the left side of the body, the blood will flow to the right side. When you press below, it will go up. When you press up, up means when you press on the hands, the blood will go below. Simple. From left to right, from top to bottom. So simple. Now the liver is, where is it? And here, top bottom is all with respect to what? With respect to the navel, because navel is the epicenter. So when I want to stimulate any place below the navel, all that I have to do is I have to work on the hands. I have to give pressure on the hands. When I want to stimulate above the navel, here, etc., above the navel, then I have to work on the legs. Simple. Then if I have to work on the right side, I have to press on the left. If I have to work on the left side, I have to press on the right. So simple. How to do it? How many times to do? That is where the neurotherapy expertise comes. It is not that you go on stimulating or as you like. So what do we do? We have got a treatment called 1 point liver into 60. I call it short 1PL6. 1PL6 means 1 point liver into 6 treatments. How is this to be given? It's given point liver. That means at any time I am only pressing for 1 point on the liver. Now, as I said, the liver is on the right side above the navel. So I have to press only on the left thigh. And I have seen that I have to press on the, by our expertise, by our experience, we know we have to press simultaneously on the hand and on the leg. So how do I do that? I press over here, and with this portion of the bone, I press here. I break this area into 3 points. 1, 2, 3. 1, 2, 3. Similarly, I break this region. 1, 2, 3. Okay. Okay. So now you can easily see that. Okay. 1, 2, 3. So what do? I first place one hand over here, and then with this portion of the hand, I press down here, down vertically down. So I just go like this. Okay, and I lean forward, because if I am sitting behind like this, I can't develop pressure. No, very simple. So just lean a little bit forward, and because our thigh muscle is going inwards, so I have to, whatever pressure I have to do, I have to push it inwards. So now I show you. I just do like that, and then I pull inwards. And then here I say 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. So this is 1 point liver into 1. Now the liver is a huge organ. It is from here to here. It's a very big organ. That is why we are dividing this into 3 locations. Okay, because then it will cover one location. When I gave it here, it will cover the circulation right at the edge, near the rib cage. And where is this the pain point of the liver located? Now all of you know the pain point of the liver is located The liver is not located here, but the pain of liver is located horizontal to the navel on the right side. I repeat, the pain due to liver not getting proper supply is located horizontal to the navel, and we have mentally split it into 3 locations. The extreme outside location is benefited by this treatment. Okay, now 1 minute is over. Now next I have to come to second location. Now second location, how do I do? I keep my, see, first my hand was here, now my hand is here, and then similarly here it is in the middle thigh, middle of the thigh, and again I pull it inwards, and again I say 2 1 2 2 2 3 2 4 2 5 2 6. Why I am saying 2 1 3 1? Because then I will know when the 6 is over. I have to give 6 isn't it? So now again I am waiting for 1 minute, and in the meanwhile I'll teach you, I'll discuss. So we gave first 1 point liver in the first location. Then after 1 minute I give in the second location. Okay, this time gap is needed because the liver is a huge organ. I stimulate it in small locations. So first one part is stimulated, then another part is stimulated, then another part is stimulated. Okay, and you will say, how do you know it's working? Yeah, with those who are having pain over here, if you give 2 or 3 rounds, you will see that the pain is reduced substantially. On this, what you know, it doesn't require me to tell you. You will confirm on your own. If anybody is having fatty liver, if anybody is having slight feverishness, if anybody is having too much body pain and too much stiffness of the joints, all of them immediately you can benefit. And I request, a simple request. See, I am taking so much time. All of you, if anybody is trying, first of all, you should try. You should take it, this treatment seriously. Try it, and if you get some result, please share it immediately in the group. You can share it here also, but please share it in the group. Yes, I got benefit by liver treatment. Okay, and it does not require several days. Within 1 day, within 1 treatment, it will come. It can come. Okay, now last point, third point. Now here 1 2 3. Third point is near the wrist over here. Okay, don't give on the wrist bone, just give below the wrist bone here, and then with this portion of the hand we are pressing near the kneecap, but not on the kneecap, not on the kneecap, near the kneecap, just a little bit below. This is the kneecap, but below this, here you have a depression, slight depression. So keep there, again pull inwards. 3 1 3 2 3 3 3 4 3 5 3 6. So 1 2 3. So this is 1 point liver into 3 treatments. Now I have said 1 point liver into 6 treatments for good results. So next, suppose assuming now 1 minute is over, at least 30 seconds is over, I know. So you can just wait for a few more seconds. Between 30 to 45 seconds is the minimum. Then you can do the next treatment. So now let us say the fourth point. Now we gave 3 points. 1 2 3. Fourth point, again same. Now the technique is not changing. Same way. Pull inwards. 4 1 4 2 4 3 4 4 4 5 4 6. Okay, wait. Then wait for 1 minute or 40 seconds. Again, same way. After from fourth, we will come to fifth. So fourth point was here, fifth point will be here, and here it will be the middle thigh of the thigh. 5 1 5 2 5 3 5 4 5 5 5 6. So that was 5. Then again wait for a minute. And when you are waiting for, when you are actually doing, you can even do Nadi Shuddhi Pranayama. At least 2 or 3 rounds you can easily do alternative nostril breathing. Then that will give even better results, because by Nadi Shuddhi Pranayama you are increasing oxygen to the tissues. So the liver is getting more benefit. Okay, so like that. Now I am not showing, but all of you know Nadi Shuddhi Pranayama. So you can just do that 1 round or 2 rounds. I tell you, please take this seriously. Next week, all of you will come with the results. say that I have got so much benefit with this liver treatment. No other treatment is needed even. Yeah. I mean, other treatments will be needed for serious issues, but this liver treatment is enough for almost every minor disorder in the body. Now the sixth, 5 is over. Now sixth, again same way. And 4, 5, 6. So 6 here, 6, 1, 6, 2, 6, 3, 6, 4, 6, 5, 6, 6. Okay. What are the benefits? Body temperature, fever, feverishness, liver problem, fatty liver, jaundice, malaria. If you had malaria in childhood, this is very good. If you had typhoid in childhood, very good. You can do this continuously every 4 hours, every 3 hours. You can do within 3 days, 4 days. Your body will improve. Yeah. So that is the advantage. And why? Because the liver is the mother of the body. And the liver is been not getting proper blood supply due to our wrong posture, due to our stooped posture, etc. So we have now covered 2 major treatments which are very useful. One is for the adjusting the body temperature by the thyroid gland, and other is for fevers, for fever and all joint pains, etc. Everything, all problems related to liver, fatty liver, etc. For all that, this liver point is very good. Now let us see what more we can do. Now we gave body temperature to come down. Is there any simple treatment for body temperature to go up? Yes, we have a treatment. I will also tell you where it is useful. First of all, it is very useful for cold hands and feet also. Apart from thyroid, apart from liver also does the same thing. Liver also will stabilize the body temperature. If it is feverishness, it will bring it down. If your body is cold, it will bring it up. Same treatment, no other change. In liver, same 1 point liver into 6 will do that also. 1 point liver into 6, 1 PL6. So when I write in the group, somebody asks a question and I say, give 1 PL6, this is what it means. 1 point liver into 6 treatment. Okay. So this is one. Next we are coming to I told you we are working on blood supply, lymph and nervous current. Now I am going to teach you a treatment, a simple technique for nerve regulation, let us say. Now, all of you know there is one organ called the hypothalamus. You may be knowing it's working also. Okay, hypothalamus is actually part of the brain, but it is a major player in the endocrine system, the hypothalamus. And the hypothalamus has got a connection with body temperature. It has got a connection with hunger. It has got a connection with thirst, satiety, so many things it has got. So, can we stimulate the hypothalamus? Neurotherapy says yes, you can stimulate. How do you stimulate it? We have a treatment called medulla treatment. Somebody, you might have seen my video on medulla earlier, does not matter. For those who are new, please try to understand. Very simple treatment, and it can be done with 1 finger. You don't require much pressure also. Then where is this finger to be applied? How many seconds? I'll tell you. Now, on the left, we start with the left always. In neurotherapy, many treatments we start with the left. On the left side, you know, here is the bone behind the ear. Okay, now this is the ear, and here behind the ear you have the bone. Actually, it is part of the skull actually, and below that you have a fleshy area. So vertically from this area, I am going to come down. Now I am going to use another camera which will help you to see this better. I think you will be able to see me better here. Yeah. Now I will have to switch on the camera. Phone transmission. Yeah, you have already, somebody spotlighted me. Not yet.
Sir, actually, I think this camera is fine
Okay. Oh, very good. Fine, fine. Then I don't have to bother.
because it covers your full body. So
Yeah, yeah. But here I want to see with clarity this area, this show. I want to show this area. It's okay, as you say. If you are able to see clearly this area, see, I'm showing. Are you able to see clearly?
yes, sir.
Very good. Fine. Thank you. Thank you. Thanks a lot. Then we continue as usual. Okay. So here I have to go. I have shown you the location just below this ear bone. I mean, this is not the ear bone actually. This is the skull. So below the skull, where the skull ends, from there vertically down, I have to come right up to the clavicle over here. Okay. So I have to come vertically down. So I'll show you, and you have to do. It is called 6 medulla. You have to do 12 because each comes these cranial nerve. It's actually for the 6th cranial nerve. So it comes in pairs. So we have to do 12 times like this. 1, 2, 3, 4, 5, like that. I do have to do 12 times. So all of you can see, and you can also do. If anybody is not having proper hunger, if anybody is feeling body temperature, if anybody is feeling a bit cold in the fingers, etc., you are having either too much thirst or lack of thirst, too much hunger or lack of hunger. For everything, it is a very nice palliative. So let us see over here. Let us start 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And at 12, you have to hold for a few seconds. Okay, you have to apply somewhat pressure. It should not be like a feather touch. No, it should not be like that. It should be with some pressure. I am applied from here to here. This was on the left side. Then I have to go to the right side. So from the right side, same way. Again, see, this is the just below the skull. So I give 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12. So this 12 means 6 medulla. I told you because this medulla is working for the cranial nerve, and cranial nerves work in pairs. So 6 medulla means you have to do 12 times. I will also show you another technique later, another technique in my next classes, another way of giving this treatment for another person. For yourself, this is easy. Even for another person, you can do like that. But I will show you also another way of doing, very simple way. Okay, so that we will see later. If necessary, we'll do it on another class. Okay, so now I have given one treatment for body temperature to bring down for fevers, etc. Then now this treatment will help the body temperature to go up. Where can it be most useful? If I tell you this, you will be amazed. I have already told you where it's all. One new place where you can use it. You know, for those who are ladies, they will know that approximately during the middle of their cycle, that is the 15th day or so, their body temperature should rise up by a few, about 0.4 degrees. Not few degrees centigrade, but it's about 0.4 degrees. Okay, the body temperature should rise up. Then only you can conceive. So for ladies who are having infertility problem, for them, if they do the 6 medulla before getting up from bed every day, then there to a certain extent, this problem of low body temperature on the day of ovulation, this will not arise. Of course, it may take 2 or 3 cycles to stabilize, but you have nothing to lose. Those who are trying even artificial insemination, I mean, or even in vitro fertilization, IVF, etc., even for them, this technique is very useful, because no matter how you are going to conceive, the temperature of the body that is necessary for the egg to mature. Okay, and this is helping that. How do you know? You can see it. You take a diary, and from today, tomorrow, that is morning, every day in the morning, though this is for ladies who are wanting to have children, for them. Okay. For them, you just take this is called basal temperature chart. Just write, have a small pocket notebook, have a pen, and have a thermometer. All these things should be kept under your pillow. You should not lift your head, because if you lift your head, the body temperature will go up, and then that is not what we want. We want that the basal temperature should go up. So what you do, you put a thermometer in your mouth just as soon as you get up, note the temperature, and then give the 6 medulla, then note the temperature. It may not immediately show up, because it is only a small, from 98.4 to 98.6 Fahrenheit. That's all, or 98.7 Fahrenheit. So only 0.3 or 0.4 difference will be there. But if you are this thing, you will see the result in your body. You are regular. So all that you have to do, just do 6 medulla early in the morning before rising your head. And the temperatures also should be taken with your head on the pillow, because the moment you raise your head, it is because of activity. It is not because of the body being corrected. Understand? So this is very useful. Now we will go ahead with this thing. We have got now temperature, then hunger. As I said, for children, small children, to feel hungry, many small children, when you bring the food, they will just look here, they will look there, and then the mother has to show the crow or the sparrow or a dog or a cat, and then say, look at that, and then she has to feed. Now, all this is not needed. You give 6 medulla before they come for food. You will see within 2-3 days their hunger starts improving like anything. 6 medulla, very simple. Okay. Then we have got another treatment for hunger, a very good treatment for hunger. This should be given to all. This can be taken by everybody. It can be given to children. It's a very safe treatment. What does it do? It increases the circulation to this location. And how does it do it? It uses what is known as the Vajra Nadi. The Vajra Nadi. Where is the Vajra Nadi? The Vajra Nadi is coming over here, right on this place where you are having the big toe. Over here, right over here. The Vajra Nadi is coming over here. You will say, how do you know it's the Vajra Nadi? I'll tell you. All of you are yoga experts, definitely. You have heard of an asana called Vajrasan. Why is it called Vajrasan? Because it is stimulating the Vajra Nadi. Okay. So, and how do we sit? We sit like this, no? Very simple. We sit like this. We sit like this. So what are we doing? See what am I doing? I am only stimulating the Vajra Nadi. You will see that mainly only your big thumb, only that the others are all on the side, they are raised. Only the thumb is having the full pressure of your body, and it helps you to keep straight also. So when you sit in Vajrasana, you can be naturally straight. You won't easily slouch. Okay, because when you slouch, then it will put the pain over here. So it is easy for you to sit in Vajra Nadi like this. Okay. So how is this treatment to be done? First, I will teach you how to do it for yourself. Then I will teach you how you can do it for others. So now here, this Vajra Nadi, I told you, it starts from here and goes right up to here. Okay. and on both legs. Okay, this is the left leg and the right leg. So what I have to do, I have to stimulate the Vajranadi. How do I do it? Very simple. I'll show you now on one leg. I am showing you now for the left leg. Okay, so I keep my hand like this. Okay, like this. I keep my hand like this. This is just resting here. I am not giving pressure here. I am only going to give pressure with my thumb. And where do I give the pressure? Right here, where the ankle bone. From there, you are finding a point over here like this. So over here. So all that I have to do is just place my finger. If I am keeping it a bit curved, you can do it straight like this also. Okay. Now I am showing it like this because then you can all see me better. So I am keeping the rest of 4 fingers here, 1 finger here with quite some good pressure. Like that, I am going right up to the nail. I don't cross the nail. Okay, just before the nail, I bend down and then I hold it here for 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So this is 6 seconds. Okay, like this, I do 3 rounds. Second round, I go like this, go down 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Then third round, 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. So this is called CNNS gas. Gas on the left side. Then here also you have the same point. Why it is called gas, I will come to it. Then here, now I did 3 times here. We can do more also, but 3 is enough. If you are doing on a daily basis, 3 is adequate because you have to do it before every meal. Whether you have a biscuit or whether you have a bread or whether you have a full nice meal, you have to do it. Then it produces results. In our last diabetic challenge class, so many people got benefited by doing it. Some of them have even spoken on in the class that we have got benefited by this simple treatment. It reduces gas. That is why it's called gas, because it removes the pain due to gas. You know, due to gas, stomach gas, it removes the pain over here. Okay, in this region, just below the solar plexus, that region, that is called stomach region. Okay, and below that is the region of the intestines, the duodenum, etc. So duodenum, jejunum, etc. So it improves the blood circulation to that region. That is why it is called, the treatment is called gas, CNNS gas. CNNS means it has got a different name, complete new Nabi set. We just call CNNS gas. That is this treatment I showed on the left leg. Now let us do on the right leg. Same way, in the right leg again, I can either use the same finger and do like this. I can do like this, or I can use this side and do like this, whichever is comfortable. Okay, for me, I am finding it comfortable with my right hand itself. For both hands, I am finding it comfortable with right hand. You can use your left hand also like this. You can. Same way, where is the Vajranadi? It is coming from here, right up to here, and then going up to here. So all that I do, with great pressure, I apply good pressure. I do like that. I do like that. I go down, and here I am not applying any pressure. Here I am just giving support and applying pressure. I go down 1, 1, 1, 2, 1, 3, 1, 4, 1, 5, 1, 6. Then again, apply pressure, go on doing 2, 1, 2, 2, 2, 3, 2, 4, 2, 5, 2, 6. Then third time, 3, 1, 3, 2, 3, 3, 3, 4, 3, 5, 3, 6. So now we have done first on the left side, then on the right side. So it is better if you do it like this. But suppose you say, I don't have time, so much to do. I want some shortcut, because nowadays the world of shortcut, no, computer means shortcut. So for that, what I say, keep your leg like this, and I will show the same way. I can do like this. I can slowly do like that and come down and then bend it downwards. Then again say 1, 1, 1, 2, 1, 3, 1, 4, 1 5 1 6. Then second round, same way, 2 1 2 2 2 3 2 4 2 5 2 6. Third round, 3 1 3 2 3 3 3 4 3 5 3 6. If you do this before every meal, this and the liver point, both one after the other you can do. First you can do the CNS gas, then you can do liver. It is wonderful, I tell you. You will not believe the amount of benefit you will get. You do this for 1 week and then you can come back with your results next week. Unfortunately, very few people are writing their comments in my classes. They are writing in some classes, but they are not writing specifically what they are getting benefit. I request all of you, if you value my words, if you value the way sincerity with which I am teaching, please write. Please do this from tonight, from today till next week, next Friday when we meet. Till that time, keep doing it. Every meal, first you give the CNS gas, it's called, or I call it CNG, CNS gas, CNG. CNG means this one. Okay, 3 times you do. Okay, you can do more also if needed. For example, suppose you have gone to somebody's house for marriage or for some reception, and then you have eaten. They are all telling, sir, you have come after such a long time. Please have some more. Please have some more. Okay, you eat. Immediately after the same night, you can come and do liver, or you can do next day morning itself. You can start the whole day. You do this liver, gas, liver, gas, liver, gas, liver. Do it 2 rounds, 3 rounds, 4 rounds. Doesn't matter till you feel here lightness. You should feel lightness here. Finished your problem. You will see, I have digested very well. Very good for improving digestion, I tell you. Very good. So please, all of you, make note of this. CNG on both legs together, or you can do it. Somebody will say, I cannot sit cross-leg, I am having knee pain. Don't worry, just go put your foot on the ground and tell somebody else to do it. Or if you can get one leg like this up, then you can do like that with one leg. First you do on the left leg, then you do on the right leg. It can be done. Okay, and if you cannot do it for a long this thing, suppose there is still, I have got one more treatment. This I have not taught up till now to anybody. None of the previous classes. It just came to me as a this thing, sudden spurt. That's what I call that Guruji comes and helps me. You know, our leg, thumb, this heel. When you are sitting on the floor, can you not press this point with your heel like this? I'm just showing you here. It is difficult to show, but I'm showing you. See, can I not press like this? Can I not press like this? Of course, on the bed it is awkward, but suppose your leg, you are sitting on a chair and you say, I cannot fold my leg. I cannot fold my leg. Don't fold. Keep your leg down. Let them be dangling, but they must be on a firm ground. It is not that you sit on a very high chair and then your leg does not reach the ground, then it does not work. So what you do, just put your foot and with one leg, with this leg, I mean this portion of the leg, you press this portion for 6 seconds, or even you can go up to 12 seconds. Just press, because here we are not pulling. No, we are not able to pull. So just press there for 12 seconds. First you with your right leg, you press on the left leg, this big toe, the joint. You have to press over here on the joint, just on this joint. Okay, on this joint you have to press. Fine, that's all. You press first on your left leg, then do the same thing for your right leg. Hold for 12 seconds like that. Do 3 rounds. Okay, wonderful. So is it not a very useful, very simple thing? If you try it, you will understand. Only thing is, it is like, somebody saying, I gave him a mango and say, this has got very good taste. Then he says, how do you know it is very tasty? I said, smell it. Oh, it smells nice. How do you know it's very tasty? I said, unless you eat it, I cannot tell you. So I cannot tell you all that much. You have to eat it. Like that, you have to test this. I know it is tested over lakhs of people, lakhs. Over the past 30 years, more than 8 lakh people, more than 8 lakh people, at least 12 lakh to 15 lakh people have benefited by neurotherapy. Because I told you, we are having almost 10,000 centers all over India and a few abroad also. For small children, this is a veritable panacea. This particular treatment is very good for small children, for people who are just looking here and there, like that they are doing. For those such children, this is very good. Give CNNS gas, CNG, give it. That's all. 3 times you give, and then you will see that, and so then give 6 medulla, and then give 1 point liver. Bas, this sequence, wonderful. In some, of course, in sometimes we give first 6 medulla, then we give CNG3, then we give 1 point liver. Wonderful treatment. 6 medulla, CNG, and then 1 point liver. That's all. Into 3, into 6. Wonderful. So nice. And this also helps in BP. Now to come to our one of our main this thing. BP also it helps all these. For simple, I mean, there are many treatments for BP. Some of them are very long also, but at least to start with, if anybody is having BP, they can start doing this. Then I'll give you one more small trick about BP. You know, your little pinky finger, this pinky finger, no? Pinky finger. All that you have to do, just put the pinky finger into your ear, The pinky finger will go, other fingers will not so easily go. Ear hole is not very big. It is reasonably small, but it is good for the pinky finger. So just put it on the inside the ear, and then you have to give 1, 2, 3 downwards. Then in any direction you can do 1, 2, 3. Then up 1, 2, 3. Then this side 1, 2, 3. That means in 4 directions: down, this side, out, then up, then this side, front and back. Okay. So you have to do. I'll just show you how it is to be done. Just do like that. 1, 2, 3. Down I did. Then I'm going to do like this. 1, 2, 3. 1, 2, 3. Then I'm going to do up. 1, 2, 3. 1, 2, 3. Then I'm going to do back. 1, 2, 3. That's all. Do this every night. Do this in the morning. Do this before going to bath. Very good treatment for blood pressure. There are many more such simple. These are all very simple treatments. This one is not really neurotherapy, but it is told by our Guruji. So for blood pressure, which is one of our main topics today, I have told you one is this thing, liver treatment and all those things. And then that is first you give 6 medulla, then you give the gas CNG, and then you give 1 point liver. That is one. Then you can do this before taking a bath. Okay. Then another thing, because it is now a bit warm in many parts of India, it's now very warm. Here in our place it is cool. So I am in Assam now. So it is cool here. So it's not so hot. So those of you who are taking bath in cold water, you don't have. It is always better to take bath in neutral or cold water. Warm water is hot water bath is not so very beneficial, but it has to be taken for people who are having joint pains. Okay. But otherwise, if you are not having any pain, the best water bath is a cold water bath. So in that, just keep some water in the mouth. Keep it in the mouth. And then take your bath. And then at the end of this whole bath, you can spit it out. Even in the middle also, if you want to spit it out and again take it's all right. But normally they say once you put it in the mouth, keep it till for about 10 minutes or whatever it takes for you to take your bath. For that you do that. So okay. So this is also a very good technique. Cold water in the mouth, and then spitting it out at the end of the bath. Very nice for keeping your blood pressure under control. So many things I have told you. Now, I have got many more. Arsenal is plenty. We have got about 8 minutes left now. So I will tell you another very simple thing. Very simple but very effective. Again, as usual, as all our treatments are, they are very simple but very effective. And what I am teaching up till now is only what you can do simply to yourself. You don't require a therapist right now. I have certain therapies, certain treatments which require therapists. But that is all for later. And if anybody of you is having a particular problem, you can write to me your area where you stay. I'll put up my existing phone number in the group. So you can all, or I will tell it at the end. So you can all write where you stay, then I can find out whether we have a therapist in your area, then you can go and take treatment. Okay. So that's how it is. And the treatment is not very costly also. It depends on the city, of course. But on a general 300 to 500 rupees is normally this thing in small metros. Bombay, Delhi, Calcutta and all, they will be slightly costlier because there the cost of living is very high. Otherwise, you can still it should be affordable because it does not require any medicines. You should always see that side effect of medicines is avoided and medicines themselves are avoided. So that is how it is beneficial. Okay, so now one treatment which stimulates healing, the natural healing process of the body. And do you know what is actually the chemical which produces natural healing? That is called bile, pitta. So where is bile made? Bile is made by the liver. Bile is not made by the gallbladder. Remember, bile is made by the liver, it's stored in the gallbladder. That means we have to stimulate the liver and the gallbladder. Once you do that, then you may say, which should be stimulated first? It is like what is the gallbladder? It is the godown of the liver. So first I should empty the godown, then only I can put fresh material. So that means what? I should first stimulate the gallbladder, then stimulate the liver. In fact, I recommend all of you who are following other therapies, other holistic therapies, if you are having, I know you will be having treatments for liver and gallbladder, I request you to talk with your principals and tell them that is it Ramchandran sir is telling like this, can I stimulate first the gallbladder and then the liver? Then whatever answer they give, you will follow that. But if you tell them this logic that gallbladder is the godown of the liver, so if I have to stimulate, I should first empty the godown, then only fresh material can be put into it. Then they may agree. Okay, or maybe they are already having this sort of a technique that you stimulate the gallbladder first and then the liver. Okay, I have not recently listened to other people's recordings, so I do not know. But you can discuss, and you can also let me know in the next class in case some of you have discussed with Raghavan sir or anybody, Vasoraj sir, whoever, can discuss and then find out if they will give you the answer. You can tell it to me. Then I will also stand corrected, sit corrected. Okay. So what is this treatment? Gall liver treatment. And it is to be done 60 times. For small children, you can do it 20 times. But it must be done in 3 rounds. So where is it to be done? According to neurotherapy, on the left leg, the third toe is the toe for gallbladder, 4th toe is for the liver. Okay. So now I will just show you here nicely. Okay. Now I hope my voice is all right. Yeah, it is all right. Okay. If my voice is not coming through, please let me know. Okay. Now I should. Okay. Now this is the third toe. Okay. So what I am now going to show here as if think this is my toe. Then this is the third one over here. Okay, just think like that, that this is toe. So what I am doing is, you can see me, you can see me now. What I am doing is just twisting. You see, I am twisting like this. Okay, and then I am twisting like this. Okay, the same thing I should do on my left leg, third toe. Left leg, third toe. That is the toe for gallbladder. I told you first gall, then liver. So left leg, third toe. What I will do? Where am I twisting? I am twisting right at the edge over here. Over here. I am keeping my finger like this, and then I am going to give a twisting like that. Okay, like that I am going to twist. So I can, of course, I can keep my finger any way I like, whichever is comfortable. For me, keeping the finger like this is even more comfortable. Okay, so that's how it is. Okay, now I twist 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 30, 40, 50, 60. So this is 60 times I have just shown. 60, you assume it is 60. Then I do like this over here. Again, same 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 20, 30, 40, 50, 60. So I have just speeded up. So this is on the third toe. Then the same way on the fourth toe. Like this I do. I keep my finger like this, and then I do like that. You see, you can see over here. Over here I am giving 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 20, 30, 40, 50, 60. Then again like this, put your finger inside. I put my finger inside like this. See, I put my finger like this, I put. Okay, now you see, 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 20, 30, 40, 50, 60. So 60 on this toe, third toe, 60 on the fourth toe. Where am I giving? I am giving over here. Okay, just on this joint. Where the toe leaves the foot, that joint. Okay. That is called proximal phalangeal joint, interphalangeal joint. Okay. So that is where I do like that. So 60 on third toe, 60 on fourth toe, then wait for a minute. Again 60 on third toe, 60 on fourth toe, wait for a minute. Then once again 60 on third toe, 60 on fourth toe, wait for a minute. This is very good for healing all wounds. A person, children getting hurt. Normally we will go for betadine. Go ahead later. But first, immediately for reducing the pain, you can do this. Or even with betadine, you can do this. Because betadine immediately won't reduce the pain drastically. This is done 3 times, it helps. So this is one thing. Then another this thing at the same time. So another, let us say, household remedy. If there is a wound which is bleeding, and you don't have betadine immediately at home, suppose you have to go to the doctor to get it, let us say. Then, but it is so late, you don't have time to go to the doctor, or maybe it is inconvenient. Do we have a solution? I have a home remedy for you. What is the home remedy? It's called coconut water. Which coconut water? Not the one which we drink, which we call in Hindi dab. No, in Hindi or Bengali, it's called dab. No, the other coconut water which you are putting in front of the Ganpati idol, we are breaking. Okay, South Indians know. That coconut water. That coconut water is an excellent healer. Excellent healer for all cuts, wounds, right up to bed sores. It heals. For small cuts and wounds, it heals immediately. You will say, how does it heal? Because it contains, first of all, it contains so many minerals which are essential for healing. And secondly, it contains natural glucose, and it is glucose which does the healing, but it will not increase the blood sugar. So it can be safely done even by diabetics. What you have to do? Just take some coconut water. And even there, I've got a practical solution for you. What happens? This coconut water, if it is broken within 2 hours or 1 hour, it will ferment and it will get spoiled within 2 hours. It will start becoming rancid. Okay. But suppose you take it out. Somehow you are able to take it out by a syringe, then it won't get rancid so much because it is closed. How to take it out? You know, the coconut has got 3 eyes in the head. You know, it has got 3 eyes. Just put a diabetic syringe. Diabetic syringe, you put it inside the hole and then take the water, take the coconut water. The moment you pull out the syringe, that what incision you have made, it will just seal up, because that is because of the natural pressure within. It will seal up. So then it will not be getting exposed to the atmospheric oxygen. It won't get oxidized. So you can do it for a whole day. Normally within three such applications, the wound will stop bleeding will stop. So that is for bleeding wounds. And for non-bleeding, and after doing that coconut this thing, you do this 60 toe finger. This is called toe finger, TF. 60 TF gall liver, GL. 60 TF GL. And we are doing it 3 times, so into 3. So 60 TF GL into 3. You can write it down. This is very good for hurts, wounds, for minor burns, cuts, injuries. For all these things, it is very useful. Okay. So this is a wonderful treatment. Now with this, this is now 9:45. I would be very happy to meet all of you again next week. And now we can call it a day. And 5 minutes I will give for any very important, anybody wants a repetition of any particular this thing, I can give you a repetition if necessary. So now I will. Ravinder Kaur ji has raised her hand. I hope, Ravinder Kaur, I hope, where is, yeah, I would be, Anusha madam will be very happy if I can see you or see your video. Yes, madam. Yes, madam. Yes. Namaste, madam.
Good evening, sir.
Yes. Good evening, madam.
The therapy is wonderful. So happy. Sir, first one, the temperature wala, if you can repeat.
Yeah, sure. See, the temperature wala, which one? The one over here with the thyroid or the one with the medulla? नहीं, आप म्यूट हो गए हैं. आप म्यूट हो गए.
आप बोल रहे थे ना, left is hot and right is.
Okay. That's very simple. See, okay, I will show you that. You can see very nicely. Now here, this is the Adam's apple. This is the Adam's apple. ये आपको दिखता है ना, ये Adam's apple. ये आप अपने ऊपर हाथ लगा के देखिए और अगेन आपका अनम्यूट हो गया.
सर आप दिख नहीं रहे.
अच्छा, अनुषा मैडम
नहीं आ रहा.
हाँ ठीक है. देन आपको बंद करना पड़ेगा. हाँ, यस, ओके, राइट. थैंक यू. सो दिस पोर्शन यहाँ अभी दिख रहा है ना. मैं दिख रहा हूँ. हेलो कौर मैडम, मैं दिख रहा हूँ क्या? नहीं, आपकी आवाज नहीं आ रही. आप का कैमरा हमने बंद किया है, लेकिन आवाज, आप अनम्यूट हो जाओ. आप दबा दो अनम्यूट. ओके, अदरवाइज ठीक है. आई विल कम टू यू मैडम. मैं आपको दिखा देता हूँ. ये देखिए, ये आपको मैं दिख रहा हूँ. तो ये देखिए, ये यहाँ है ना. तो ये जो है, ये यहाँ एक बोन जैसा है. तो यहाँ एक बोन जैसा है. तो बोन के साइड में, सॉरी, आई विल गो इन इंग्लिश. So the side of this bone, there is a muscle. So इस side में is the muscle. You just press and go on doing like that, like this. ये देखिए, ये muscle. It can be here, थोड़ा सा पीछे, आगे पीछे हो सकता है. It can be front or back. Okay. It can be anywhere, slightly here and here in this region. Just shake that area till you get out of the pain, until your finger become warm. Okay. It may take 1 minute, 2 minutes also, does not matter. Okay. ये बड़ा safe है. And you don't up 1 minute, don't do it continuously for 1 minute. Just do for about 30 seconds or 20 seconds, then give a small break, then again do like that, just do like that, then give a break, and again just do like that. 5 seconds, 10 seconds के लिए. So like that you can do. Okay. Yeah, you are doing correctly. मैं देख रहा हूँ आप. हाँ, बस like that. नहीं, आप see what you are doing is you are using your, एक minute, you are using your finger like that. ऐसे नहीं, keep your finger just flat. So flat रखिए, and then even now you are not fully flat. थोड़ा flat रखिए. हाँ, yes. Shankar Ramji, you are doing wonderful. Yeah, other people, those who are unable to follow, please you can yeah. Renu ji is also doing wonderful. हाँ, Zora Anis madam, तो वही है रविंद्र मैडम, वही है, that is it. Zora Anis, please unmute and talk. Zora Anis, Zora madam, please unmute and talk.
Sir, namaste, sir.
Namaste.
Good evening.
Good evening.
See, I wanted to ask about the gallbladder. You said twisting, no, sir?
Yeah.
Twisting का बोला था ना आपने?
Yes.
तो एक बोल रहे थे, एक बॉटम में एकदम लगा हुआ बोन को, फिर ऊपर से, तो उसको 60 टाइम्स नीचे भी 60 टाइम्स ऊपर भी करना है कि नहीं? वो कैसा करना है?
एक मिनट, जब आप ऐसे कर रहे हैं, when you are doing like this, automatically top and bottom will come, no?
अच्छा. Okay.
Automatically.
तो पूरा मिला के, totally, completely you have to press it.
Yes.
Okay, that I was a bit.
I will tell you one thing. Just go to Joshys Kerala group and then look at the video. It is there about, I think 2-3 weeks ago. I have put one lady is doing this. So you can see
that video is deleted, sir. That video is not there.
Okay.
It is not there.
Okay, never mind. No, that's okay. We will see. If necessary, I will send it. But doesn't matter. Now you have understood. It's very simple.
Yeah. Okay. Thank you so much, sir.
Okay, welcome.
Okay.
Then immediately, then Rajeshwari madam, namaste amma. Namaste akka.
I am first conveying my thanks to you, sir, for the daily I am doing your me.
So your voice is getting cut.
Sir,
Yeah.
I am following your instructions daily, sir. I have gone a tour. There also I have done morning time, all the things and all that. I have managed the tour very nicely because of you and our Raghavan sir's teachings and all that. With that, I have managed the tour very nicely, sir, with all the problems. I am asking one doubt, sir.
Yes.
Sir, in the CNS gas care, we are using the toe at the tip, isn't it, sir?
Yeah.
Whereas the gallbladder liver, we are using at the bottom, that is the round. Why, sir?
No. See, that is the Vajranadi comes. Wait a minute. I'll answer this question. Very good question. Sir, madam, at your age, you are so very inquisitive, very nice. I am very happy.
Thank you, sir.
Really,
Thank you, sir.
so many people are smiling because it's a very nice thing. So what happens? See, the Vajranadi ends right at the toe.
Okay.
So there we are working on the Vajranadi, which is working ending right at the toe. Okay,
sir.
But in that gall liver, we are going to the nerve plexus, which is around the ring.
Okay, sir.
We have a treatment where we are using, like Vajranadi, we are using the in the gall and liver also. Later in advanced treatment, we have got a treatment where we will be doing like that and then doing like that. Okay, but right now, see, I have to first take everybody through ABC. I cannot straight away jump to PQRS, isn't it? So like that is all advanced treatments. But this is enough for this. For Vajranadi, we are using right this up to here because the thing is coming right up to here. And for the other one, we are using the nerve plexus, which is around which ends over here. The nerve plexus actually ends over here, the ring.
Sir,
Okay.
okay, sir. Very good explanation, sir. The new information we got it. Thank you, sir. So kind of you.
Welcome.
For each class, we are getting very much beneficial, and without any expectations, you are teaching and all that.
No,
Thankful to you.
no. I will not say I have no expectations. I want all of you to write in the group. Don't tell me
Okay,
that.
sir. Okay,
That
sir.
is my
Okay, sir.
very selfish expectation. Okay.
No, sir.
Okay.
No,
Okay.
no.
Now, Rennu madam, we are just got 1 minute left to 1 or 2 minutes. Rennu madam, please tell me.
Good evening, sir. Thank you so much for the very informative classes.
Yes.
Thank you, sir. I am suffering from thyroid. So I have to do on both sides or only one side?
Your hypothyroid means both sides. Only hypothyroid means left side only.
Left side only.
Left.
Because
You will
my
be
weight
feeling
is
cold,
pushing-
no? Your body must be feeling cold only, no?
Yes, yes.
So
My
that
body
is
is
why left
feeling
side.
cold.
Yeah. That's why
Left
it's left
side.
side.
Only have to do on left side.
Yeah.
Okay.
exactly.
Thank you so much. Thank
Welcome.
you.
Now there was another healer, Venkateswaran Swami. Venkateswaran ji, please unmute. Healer Venkateswaran ji, please switch on your camera and unmute. Venkateswar Reddy.
Sir,
Yes.
good morning. Good evening, sir.
Yes, good evening.
అది కోకోనట్ రెమెడీ ప్లీజ్ వన్ సెకండ్ సార్ ఎందుకంటే నెట్వర్క్ ఇష్యూ
Okay. See, coconut water. Okay, I will tell you. Coconut water is a natural healer. Okay. So what you to do, you take one coconut which we are giving for Lord Venkateswara or any of the god, the Lord Vinayaka. You take that coconut. You know, it has got 3 eyes over there in the head. So you take one diabetic syringe and push it into that. Then take the water out and then use that for healing any wound. And if you want to make the healing better, what you should do, you take some curcumin. What is it called? Haldi, curcumin. You take some haldi. In that same coconut water, you make it on a stone, make it like that, and then you apply that on the wound. Immediately that wound healing will start. So coconut water heals small wounds. I am not meaning big operative things where that be operated, that sort of wound I am not saying, but small wounds like small scratches or something you are hitting, you are with a knife, you are scratching your hand or something like that. Small wounds are there, no, in our day-to-day life we are coming across. For all that, coconut water you just apply over there with this haldi. Haldi means curcumin. Just apply, put it and then apply it on the wound. You will see healing very fast. I tell you, within 2 or 3 applications, the pain etc. will go away. And then of course 62 finger gall liver, this also you should give. Okay.
Okay. Thank you,
Okay,
sir. Thank you.
Thank you very much. Now I am this thing. We are now going to call Neela madam. Neela madam, it is too late now. If it is short, because you see Neela madam, then Neeta madam, Bhakti madam, can you ask your question in the group? Then I will answer. Because now it is too late. Anusha madam has to leave now after telling the votes of thanks. So, Anusha madam, there are 2 people who have raised their hands. What do I do?
You want to finish it off, sir?
Yeah, if there are only 2 people, we'll do that.
Yeah, any more hands raised after these 2 people will not be answered. Please note.
Yeah, only at present only 1 person I see. Okay. Neeta Tukral madam, boliye. Namaste. God bless you, madam.
Thank you, sir.
Namaste.
Sir, I have hypothyroid and my body and my legs get cold. These days I am suffering too much. Even I feel very cold.
Yeah, I have already given this treatment. I have given over here. So now I say, first you do 6 medulla over here, then do the CNNS, this one, a CNNS, CNG, we call it 6 medulla, then C and G. Then you do 1 point liver into 6. And finally, you just use this treatment on the left side. Okay. So 6 medulla, then gas C and G, this one, then 1 point liver into 6, and finally this one. For hypothyroid, we have many treatments that we will come in the advanced classes. Right now, this will help you. Okay. You do this and then let me know in the next week how it has helped. Okay. Okay. Thank you very much. Okay. Now we'll remove you from spotlight. Yes. Okay. Now, with great pleasure, I am thanking all of you from the bottom of my heart for having such a lovely interactive session. All of you have asked questions, and I hope I have been able to help you. So may God bless each and every one of us with health, happiness, harmony, peace, prosperity, and success. May the Lord Almighty God bless each and every one of us with health, happiness, harmony, peace, prosperity, and success. Thank you very much. Thanks a lot. Thank you to Joshys sir. Thank you to Anusha madam. Thank you to each and every one of the participants. Now, with your kind leave, I tell Anusha madam to finally end the session. Thank you very much.
Thank you, sir. Sending gratitude to you from all of us for this wonderful session. As always, the explanation is very easy and very particularly explained. And now I am, as usual, not opening the vote of thanks, because I want all of you to go back to the group, 75 of you, to go back to the group and share your feedback, share your queries, whatever it is, you're open to share everything. Okay. So you just use your name, you just say at Ramachandran sir and share your feedbacks, queries, and everything there. And again, let's meet tomorrow, 7:30 p.m. Till then, good night, signing off and ending the session. And with all of our thanks, we are just sending to Ramachandran sir for this session from Joshys Kerala Group 2. Thank you, sir. Good night, sir.
Good night. Good night.
See you again next week.
Yeah.
Tomorrow, please join by 7:30 p.m. And Sunday, 11 a.m. Please check and join. Thank you, everyone. Good night. Happy weekend to all of you.
Okay.